Welcome to the deep dive.
It's good to be here.
Today we are really getting into a topic that affects, well, it affects almost everyone in some way. We're talking about allergies.
Mm-hmm. And not just a runny nose. The scale it's just staggering. We're looking at, what, 1 in 5 people developing an allergy in their lifetime.
1 in 5,
Yeah.
1 in 10 with asthma. This is a massive public health issue.
It really is.
So for this deep dive, we've pulled together some really robust sources. We have consensus documents from major global bodies like the Resuscitation Council UK, the RCUK, and the Australasian Society of Clinical Immunology and Allergy, or ASCI.
And the mission today for you is to build a really clear picture. We're going from the absolute basics of, why does the body even do this, all the way to the cutting edge of prevention.
Right. Things like the gut microbiome, physiotherapy for breathing, and then crucially, what to do in a severe emergency, life-saving information. Okay, let's unpack this. We're going to distill all this expert, evidence-based research into clear, simple knowledge. And I think we have to start with the most basic question of all. What actually is an allergy?
Well, at its simplest, an allergy is really a case of mistaken identity. It's orchestrated by your own body.
By your immune system.
Exactly. Your immune system is your body's protection team. It's constantly on patrol looking for real threats, viruses, bacteria, that kind of thing.
Okay.
An allergy is what happens when this team mistakes something completely harmless, like pollen, or a protein in a peanut, or cat dander.
Yeah.
For a dangerous intruder, and it decides it has to be neutralized immediately and violently.
I love the analogy of an overly sensitive alarm system.
That's perfect.
It's like you've installed this incredible state-of-the-art security system, but the sensitivity dial is it's cranked up to 11.
Right, so it screams bloody murder, flashes all the lights, calls the authorities.
While a harmless fly lands on the windowsill.
Yep. Exactly, or a little dust bunny rolls across the floor. The problem isn't the fly or the dust, it's the system's massive overreaction to it.
And this is where a lot of people get it wrong, isn't it? They dismiss allergies as just, a bit of a nuisance, a few sneezes.
A huge misconception. The reality, and our sources like ASCI are very clear on this, is that the impact on quality of life is profound.
So we're not just talking about a momentary sneeze. This is chronic. It's cumulative.
Far more. Untreated or just poorly managed allergies, they really impact your daily function. We're talking about poor sleep quality, which leads to chronic fatigue, daytime sleepiness.
And that affects everything. Your work, your focus.
Absolutely. Imagine an adult trying to do a complex job when they haven't had a proper night's sleep in weeks because their airways are congested.
Or a kid in school trying to learn.
A child trying to focus when they're exhausted and literally struggling to breathe efficiently. It directly leads to reduced productivity, impaired cognitive performance. It's a real drag on your overall vitality.
And it can create this vicious cycle, right? It can make other health problems even worse.
Exactly. That constant low-level inflammation from an untreated allergy can worsen chronic respiratory issues like asthma or sinusitis. Or it can contribute to skin disorders like eczema or recurring hives.
And then, of course, there's the far end of the scale.
And that's where we get into the severe whole body and potentially life-threatening reaction known as anaphylaxis.
Before we get into the mechanics of that crisis, though, I think we have to clear the air on some really common myths.
Oh, yes.
Because these are beliefs that are so deeply ingrained, and ASCI points out that they actively get in the way of people managing their allergies properly.
They absolutely do.
Let's start with the environmental ones, the classic springtime myth.
Myth number 1, it's those beautiful, bright, fragrant flowers. They're the ones giving me hay fever.
It makes sense, intuitively. You see a big rose bush, it's blooming, it smells amazing, and you start sneezing.
It feels like it should be true, and yet it's generally misleading. Allergic rhinitis or hay fever is typically not caused by those plants.
Why not?
Because those plants rely on insects, bees, birds, butterflies. Their pollen is designed to be carried by them, so it's large, it's sticky, it's heavy, it doesn't travel very far in the wind.
So the real culprit it's the invisible threat.
Precisely. The real cause of hay fever is the tiny, lightweight, almost invisible pollen from wind-pollinated sources. We're talking grasses, weeds, and many types of trees.
So when you smell a lilac and sneeze, what's happening there?
It's often a non-allergic irritation. The strong perfume, the volatile organic, compounds the flower releases that can irritate your nasal passages and make you sneeze. But it's not a true immune system-driven allergy to the pollen itself. It's an irritation, not an overreaction.
That makes it so much harder to manage, you can't even see the real enemy.
You can't.
Okay, myth number 2 is the one I hear all the time. The fantasy of my allergies are terrible here,
Yeah.
I'll just move and that will cure them.
The geographical cure. It's so appealing, isn't it? But it's usually a temporary fix at best.
So you might get some relief at first.
You might. If you move away from a very specific local allergen, maybe a particular type of tree or mold you're highly sensitive to, you could have a honeymoon period. A few months, maybe a year, of feeling great.
But the body adapts.
The body adapts. Your immune system is designed to learn its environment. You'll be exposed to a whole new set of local allergens, different grasses, different weeds, different molds.
And it just finds new things to attack.
It does. You essentially trade one set of triggers for another over time. It's not a cure. It's just a temporary geographical reprieve.
Right. Now, for the one that causes the most arguments, especially for pet owners, the myth that if you just expose yourself to an animal you're allergic to continuously, you'll build up a tolerance. You just have to power through it.
This is a really dangerous one because the evidence points in the complete opposite direction.
It makes it worse.
It often makes it much worse. For someone with a known animal allergy, ongoing close exposure is much more likely to increase the severity of your symptoms over time, not decrease them.
And what about people who are allergic to, say, pollen, but not pets yet? Can they develop a pet allergy?
They absolutely can. The data is quite alarming. Studies show that among people who are already allergic to something else, like dust mites, being exposed to indoor pets can lead them to develop a new allergy to that pet in up to 1 in 3 cases.
So your immune system is already on high alert, and it's just looking for new targets.
It's primed and ready to go, exactly.
Which brings us right to the final pet myth. The idea of the hypoallergenic animal, the poodle or the special breed that doesn't shed.
This is based on a complete misunderstanding of where the allergen comes from. It is, to be blunt, definitively false.
So it's not about the hair or the fur.
It's not about the hair. The allergens are proteins, and they are found primarily in the dander, which is microscopic skin flakes, in the saliva, and in the urine. So even if the dog sheds less hair, it's still producing and shedding these proteins all over the house.
The little protein bombs are still getting everywhere.
They are everywhere. And because they're microscopic, they attach to dust particles, they become airborne, they stick to the carpets, the walls, the furniture. ASEA is crystal clear. There are no truly hypoallergenic animals.
So management isn't about choosing the right breed.
No. It's about minimizing exposure, keeping pets out of the bedroom, using HEPA air filters, rigorous cleaning. It's about managing the environment, not relying on a myth about a specific breed.
That distinction between myth and reality is so important for day-to-day life. But now we have to shift gears and talk about the extreme end of this, the life-threatening emergency, anaphylaxis.
Yes, and preparedness here it's just not optional. The Resuscitation Council UK defines anaphylaxis as a serious systemic hypersensitivity reaction. And the key words there are systemic, meaning whole body and rapid in onset.
And it's characterized by what they call the ABCs.
The ABCs, a life-threatening compromise in airway, breathing, and/or circulation.
Now, here's where it gets really interesting. Because I think for most people, the mental image of anaphylaxis is, the dramatic swelling. The face blows up, huge hives everywhere.
And that can happen. But, and this is a life-saving distinction to make, it doesn't always.
Really?
While skin symptoms like flushing, hives, or swelling are common, they can be subtle. Or, critically, they can be completely absent in up to 20% of severe cases.
20%. 1 in 5.
1 in 5. So if you wait for the dramatic rash to appear before you act, you might be waiting far too long. A life-threatening compromise of the ABCs on its own is anaphylaxis and needs immediate treatment.
Okay, let's break down the mechanics of this collapse. Let's start with A and B, airway and breathing. What is physically happening when someone says their throat is closing up?
So the immune system, in this mistaken attack, unleashes a flood of inflammatory chemicals. The big one is histamine, and this chemical flood causes 2 huge simultaneous problems in the respiratory tract.
The first one is swelling, I assume.
Correct. The first is tissue swelling, or edema, especially in the upper airway, the throat, the larynx. This is what causes the symptoms, like a hoarse voice, or that feeling of your throat getting tight.
And that's what causes that sound.
Stridor, that high-pitched whistling sound. It's the sound of air being forced through a rapidly narrowing passage. It's like trying to breathe through a coffee stirrer.
And the second problem?
The second problem happens lower down. Those same chemicals cause the smooth muscles in the lower airways, the bronchioles, to contract violently.
That's bronchospasm.
It's a bronchospasm. It's basically a severe asthma attack happening at the same time. This leads to wheezing and a persistent hacking cough. So you have swelling from above and spasm from below, both working to block the movement of air.
And if you can't move air, your oxygen levels plummet.
They drop very quickly. This is called hypoxemia, low blood oxygen. And when the brain doesn't get enough oxygen, patients can become confused, dizzy, or just show extreme fatigue from the incredible effort of trying to breathe.
And that can lead to respiratory arrest.
It can. And we have to remember, especially for food-induced anaphylaxis in children, that breathing compromise is often the first and most dangerous sign you'll see.
Okay, now for C circulation, anaphylactic shock.
Uh-huh.
This is where the whole system starts to fail because of a sudden catastrophic drop in pressure. How does a reaction to a single peanut lead to the entire circulatory system failing?
It's a truly spectacular systemic failure. Again, those inflammatory chemicals are the culprits. They cause two main things that lead to shock. The first is massive vasodilation.
Let's break that down.
Imagine all the blood vessels in your body, your internal highways suddenly widening dramatically.
So a 2-lane road becomes an 8-lane superhighway.
Exactly. And your blood volume hasn't changed, but the container it's in has suddenly become enormous, so your blood pressure it falls off a cliff.
And the second failure you mentioned.
This one is even more dramatic. It's called fluid extravasation. Think of your blood vessels as pipes. Those chemicals make the pipes incredibly leaky.
So fluid just pours out.
The liquid part of the blood, the plasma, just surges out of the circulatory system and dumps into all the surrounding tissues.
So using your analogy, the highways are now massively wide and they're full of holes.
Exactly. The patient isn't bleeding on the floor, but they are losing massive amounts of volume internally.
And the numbers on this are terrifying.
They are. The data shows that up to 35% of a person's total circulating blood volume can be lost into the tissues in as little as 10 minutes.
10 minutes.
This leads to a catastrophic drop in what we call venous return, the amount of blood making it back to the heart. And that causes profound, life-threatening hypotension, dangerously low blood pressure.
How does the heart try to compensate when almost nothing is coming back to it?
It tries to maintain its output by just beating faster. So you get what's called tachycardia, a very rapid, weak pulse. That's a classic early sign of shock.
But it's a losing battle.
It is, because that lack of blood flow means the body's tissues aren't getting oxygen. And eventually, even the heart muscle itself starts to starve of blood.
And then you get the really ominous late sign.
Yes, bradycardia, a slow heart rate.
And that means?
That usually means the body's compensatory mechanisms have completely failed. It's a critical pre-arrest sign. If a patient in anaphylaxis suddenly gets quiet and their pulse slows down, cardiac arrest is likely imminent.
This whole physiological collapse leads us to one of the most critical, but maybe counterintuitive pieces of first aid advice from the RCUK, the danger of posture. Why is standing up or even sitting up during this crisis a potentially fatal mistake?
This is a detail that everyone needs to have burned into their memory.
Okay.
Because of that massive vasodilation and volume loss we just talked about, the circulatory system is on the brink of collapse. If a patient suddenly stands or walks or even just sits bolt upright,
Gravity takes over.
Gravity takes over. It pulls what little circulating blood volume is left down into their legs and abdomen away from the heart and brain.
That's like pouring the last bit of water in a glass toward the bottom, away from the top.
A perfect analogy. This sudden shift completely tanks the venous return to an already struggling heart. It instantly compromises cardiac output and blood flow to the brain. Cardiovascular collapse and death have been strongly associated with sudden postural changes during anaphylaxis.
So the immediate life-saving advice for positioning is what?
For any patient showing signs of circulatory compromise, dizziness, feeling faint, a weak pulse, they must be laid flat.
Flat on their back.
Flat on their back. And if possible, with their legs raised, this uses gravity to help get that blood back to the core, to the vital organs.
Is there any exception?
If the patient has only severe breathing problems and their circulation seems stable, you might let them sit in a position of comfort that helps them breathe. But the moment circulation is a concern, they go flat. And the other critical exception is for a pregnant patient.
Okay, what's the rule there?
They must always be laid on their left side.
Why the left side specifically?
to prevent the weight of the baby and the uterus from compressing the major blood vessels in the abdomen, which would further restrict blood flow back to the heart. Positioning isn't a minor detail. It's a fundamental part of emergency treatment.
That detailed look at the crisis it really underscores the need for immediate, decisive action. But let's take a breath now and pivot to the long game. Let's talk about prevention and non-pharmacological management.
Yes, this is where the research is just exploding right now. We're moving away from just the emergency needle and into the subtle, ongoing maintenance of the body. And the most compelling new research is focusing on the gut allergy axis.
The microbiome, the community of trillions of microorganisms in our gut. It seems to be the answer to everything these days. What are scientists seeing in relation to early allergy risk?
The consensus is that the first 100 days of life are a critical programming window for the immune system.
The first 100 days.
Yes. Researchers have found that children who are lacking 4 key groups of microbes during this very short window are significantly more likely to develop asthma by the time they're 3 years old.
So the gut is like a training ground for the immune system.
An immense training ground. And if the right microbial teachers aren't present early on, the immune system, that protection team we talked about, gets poorly trained. It doesn't learn what to ignore.
And have they been able to narrow it down to specific bacteria?
They have. Other studies have looked at specific ratios. They found that a high ratio of a bacteria called Klebsiella compared to bifidobacteria at just 3 months of age was strongly correlated with an increased risk of all allergic diseases, eczema, asthma, food allergies, by age 3.
So what's the difference between those two? Why is that ratio so important?
Well, broadly speaking, bifidobacteria are seen as beneficial. They help digest things like fiber and produce compounds that actively train the immune system in tolerance. They teach the protection team to calm down. Klebsiella, on the other hand, is more associated with inflammatory environments. So when it dominates early on, that crucial immune training is compromised, and you end up with a system that's just overreactive.
If we can spot this imbalance so early, what can we do about it? What are the interventions?
The main strategy being trialed is the use of symbiotics.
Symbiotics, what's that?
It's a combination. You have a prebiotic, which is basically food for the good bacteria that are already there, and a probiotic, which is the introduction of new beneficial bacteria.
Can you give us an example of a trial where this worked?
Absolutely. There was a clinical trial that focused on infants who had a suspected cow's milk allergy. They were given a symbiotic formula that contained a prebiotic and a specific probiotic strain called Bifidobacterium breve M16V.
And what happened?
The results were really encouraging, and infants who got the symbiotic saw their levels of bifidobacteria successfully increase.
So it brought their gut back into a healthier balance.
Precisely. Their gut microbiome started to look much more like that of healthy breastfed infants. Now, we still need long-term follow-up to see if this reduces adult allergy rates, but it shows the huge potential of these non-pharmacological preventative strategies right at the start of life.
Okay, so from the microscopic world of the gut, let's move to the macroscopic. Let's talk about movement and breathing, specifically for asthma. Most people think asthma control is just about inhalers, but physiotherapy plays a massive and often overlooked role.
A huge role. Pulmonary rehabilitation, or PR, is now seen as a cornerstone of care for all chronic respiratory diseases. It's a whole program: exercise, education, behavior change, and physiotherapy is a key part of it. And it's proven to be both effective and very cost-effective.
So what are these physiotherapy techniques actually trying to do for someone with asthma?
Primarily, they're aiming to correct dysfunctional breathing patterns.
What does that mean, dysfunctional breathing?
Many people with chronic breathing issues develop bad habits. Things like rapid, shallow breathing that only uses the chest muscles, or constantly breathing through their mouth. These habits actually worsen symptoms and can increase anxiety.
So physiotherapy is about retraining the body to use its own machinery correctly again.
Exactly. The core principles are pretty consistent. You want to prioritize breathing. You want to encourage deep diaphragmatic breathing, using that big muscle under your lungs. It's about regulating your breath volume, slowing everything down.
And that helps how?
It reduces